just wash it out and she'll be fine. You denied a pregnant post-surgical patient's claim for ostomy bags and sterile catheters. This is Aaron from social work. Patient is 32 weeks pregnant, recently discharged from the hospital after an emergency surgery that resulted in a temporary colostomy. She's also non-ambulatory right now and uses a Foley catheter. You denied because she's exceeding the plan limits. And you also flagged it as not medically necessary. You suggested that she should reuse existing supplies where possible. You are suggesting that she could reuse them. So your utilization review determined that she's already received an adequate supply. What's an adequate supply to you? Because right now you're instructing a third trimester pregnant patient who just had abdominal surgery to rinse out used colostomy bags and reuse Foley catheters that sit in her bladder. Member may clean and reuse ostomy pouches and urinary catheters when appropriate to extend supply. That's what you're saying. What's the clinical credential attached to that guideline? Is that written by an MD, an RN, a wound care specialist, an infection control nurse? It says utilization management with an internal reference number. So an anonymous utilization management team member, not a surgeon, not OB, not a wound care nurse, is overriding the treating provider and telling a pregnant woman to reuse colostomy bags and catheters that are designed for a single use, right? That's the manufacturer's suggestions, single use and sterile. Well, I want you to understand the risk that I'll be documenting. If she follows your guidelines and reuses when appropriate, and she ends up with a catheter-associated UTI, sepsis, or a wound infection, that not only threatens her, but it also threatens the pregnancy. The people who actually examined her are saying new sterile catheter supplies, single-use ostomy bags. Your company, without seeing her, without holding any liability,